Good afternoon, everyone. Sorry that middle was a little weak. I had a little screaming before I think about praying. It's good to be back together and good to be all in the room together. Let's start by prayer and Lillian's.
Let's pray. Father God, thank you for another day of life. It's a gift you've given to us. We thank you for the ways that you've already blessed us today. And we count among those blessings the opportunity to be in this place, among friends, familiar faces, or friends to become. Thank you for this organization, and thank you for all those who give so tirelessly of the resources and of their time to make a difference in the lives of people in this community and around this world. Thank you for this food that's been made for us. May it instill and inspire energy in us, and may your Spirit continue to be with us. In Jesus' name we pray. Amen.
Amen. Let's join together in the Pledge of Allegiance. Pledge of
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Enjoy the song. I don't know that Tom is here, so I hear you, Phil. Here you go. Let's go. Lead us. She was just approved. We're eager to welcome you. Any other guests?
I have Andrea Kaufman from Smart Start from Davidson County.
Any other guests? Okay. How about announcements? Does anyone have an announcement they'd like to share for the good of Rotary or the community?
Jason, I will give a quick update on Doug Hunt. Last time I got a message from his brother Scott. He said that Doug was able to sit up on the side of the bed on Monday. And I know it doesn't sound like a lot, but they take any improvement that they get. They have reduced the dialysis. You know, in the beginning he was 24 hours a day, and then they just went to once a day, decreased to 3 times a week. This week they decreased the dialysis to 2 times a week. Please continue to pray for him. This is a long road to recovery.
Jason, I'll add to that. I actually emailed or texted him this morning, and he texted me back. So if you got time, text Doug, because he is reading them and responding to them, so that's a good news.
That is. Let's flood his phone with some encouragement texting. That's great. Okay. Any other announcements going forward?
Got Coffee Connections tomorrow morning, 8:30 at Secret Davis Funeral Home, Thomasville Funeral Home. 8:30, see you there.
8:30 p.m. Okay. Brandon, it's good to see you. He's been deep in the trenches all summer, doing good work with the kids, so I guess they're back at school. It's good to have you back with us. Okay, any other announcements? We've got a few that are Rotary announcements. We've been talking about this, but our bingo, our Boogie Music Bingo is coming up September 12th, so that's coming in really quick. 6 p.m. right here at the Women's Club. All proceeds go to benefit CIS. Sponsorships are coming in, and that's wonderful. We still have room for more sponsorships, and here's what's beautiful to know. If you're a sponsor at this point, 100% of that money is going straight to CIS, and it's been so great. We've said this over the past couple of weeks, but the community partnership for this event has been wonderful. The overhead is kind of reduced to near nothing, and everyone is just chipping in. It's a beautiful thing. So if you'd like to be a part of that to help support CIS and the great work they're doing, come see one of us. Again, there's sponsorships and plenty of tickets is available as well. You can scan that QR code there, and this info is also on our website, on our Facebook page as well. And another event coming up for Rotary is our golf tournament, our annual F. Stewart Kennedy golf tournament. That's October 3rd. So put that on your calendars. That's going to be a 2 p.m. shotgun start, and it's going to be a great time. We always have a blast doing this tournament and being out there with one another. So put that on your calendar, October 3rd. And the next day, October 4th, our chili cook-off, which is another great fundraiser for us to do good in our community. David, any update on that you want to share?
I think teams are now up to 11. We've got good sponsorships rolling in. If you do want to do just a small sponsorship of $100 or so, we're still taking those. That would be wonderful. Otherwise, make sure you sign up. Come by, grab your tickets that day, taste the chili, 11 till 2. Judges will be there. Our celebrity judges of Jenny Varner, Mary York, and Steve Taglis going to be our celebrity judges. So start bribing them now, cash only. But got a QR code up for the event, and make sure you get over to CCM, the pickleball tournament. So a lot of cool things going on just in that little space.
That's another fun day. One other announcement, we've talked about this every month. We're doing a micro project. This month was designated to CIS communities and schools, and just trying to help them get a great start into the school year this year. And so many of you have been bringing that. Next week will be the last week. That technically was an August, but we're able to announce it one more time, and so we'll have the table open for supplies. There's a list there if you want to take a picture of it. It's in your bulletins as well. Many of you have already done this, but if you haven't, we encourage you. We'd love for you to join in with us on this micro project. And again, all these items are just going to help students that are in need in our community. Okay, I think that's all the announcements, except Hope, do you want to come and share just really quickly about our website? I do. While she's coming up, I'll share that a few of us got to go to our district membership summit this past week. Corey is not photographed here. He was there. He had to slip out a little early, but a great day. We learned a whole lot of some exciting ideas that we're going to try to implement in the club. It's a great day. Hope.
So this is just a quick reminder. Our website for the Thomasville Rotary Club is thomasvillerotaryclub.org. This is just a little snapshot of that site. I wanted to bring your attention to in that kind of that upper left-hand corner of the website. That's actually, I've got it circled here. Go ahead to the next slide. But there is a place, I mean, if you want to pay your club invoice or your foundation invoice, those have been there. But if you didn't pick up a flyer and you want the link to the Boogie Music Bingo, there's a link there. There's a link to the golf tournament where you can actually sign up, online. There's also a flyer on most tables, and Kim emailed that out today. For the chili cook-off, if you want to do a sponsorship, you can go straight to that link and sign up for one of the sponsorships directly there, and then our new member application is always there. And then just quickly, because when you pull that website up, it's kind of hard to see because it's in white, but there is always a link to get to DAC-DB and District 6790 and Rotary International. So if you just get to our website, there's always a way to get to those other 3 key websites that you might use at some time.
Thank you. Yeah, so our information that we sit here and talk about every week is always there. So if you forget to take home a bulletin or forget what we said, you can always go to our website and everything is there. I think that's it. Any other announcements? Okay, let's split the pot again.
Yay.
I think this pot is getting kind of big, isn't it? Yes.
Yes, I need to go to this list.
Yes, while she's making, come on, you're good. While she's making her way up, we do have 2 lists I'm going to pass around. These will be floating around through the whole meeting today. One is a sign up for Everybody's Day. We will have a booth at Everybody's Day. Listen, if you're like me, my church sponsors the big Everybody's Table tent, so I have to be over there for that and some other things. Many of you are in that same position where your business or your organization is serving out there too. If you can spare an hour or even half hour, whatever you can spare, sign up on here and come and help support Rotary's booth. And sorry, Jim. One other thing is Shadow Day. So that's going to be coming around. That'll just float around during the whole meeting. Another sign up is for Shadow Day. That's coming up on October 8th, but we want to go ahead and get the sign-ups flowing for this. What Shadow Day is, it's a way for us to work with students in our community, to let them be exposed to what it's like to be a working adult, for one, but to business and all those kind of things. And so they will sign up. We can sign up as business owners, whatever you do. Sign up, list your business, and then we will pair a shadow high school student with you. It's really short, it's easy to do. They typically get to your office or place of work at 9 a.m., shadow you for about 2 hours, and you make your way over here to Rotary. And that's it for the day, but it's a great experience for them. So that's coming around too. We'd love for you to sign up for that. Sorry, Jen, let's split the pot.
You're good. All right.
What's that?
Put down how many people, how
Oh,
many
yeah.
people you
If you're doing shadow, write down the number of students you can host as well.
Now
Now.
we're really gonna do something. Okay, so we collected today $116. That means that the pot is now up to $2,228. So the split would be $1,114 for the winner. I'm gonna let Andrea, since she's our visitor.
Make friends real fast.
Okay, let's see. 654 71. I heard somebody, oh. 6. And the cards are over here.
So the pot goes on another week. Okay, we're going to step into our networking nudge moment, and I'm going to invite our dear friend Joseph up to share with us today. One of the things that we love about Rotary is that it is built on networking as well, service. sure that we are getting to know one another in this club. And some of us can be here for years and never meet or know much about one another. So this is just a way for us to do that. Joseph, come and share.
Everybody knows Joseph.
Yes. He might surprise us today with something.
I've had 77 years to prepare for this moment and 3 minutes to tell you about it. My name is Joseph English Walker. I'm the third child of an English Walker who was the youngest of 10 siblings. And my father, Horace Porter Walker, who was the youngest of 12 Walker siblings. I had an older brother, H.P. Walker Jr., and a sister, Martha Jane Walker. The nurse who delivered my father was the aunt of the famous O. Henry in Greensboro. She asked if my father could have a part of his name, so he got the name Horace Porter Walker. He was the 12th kid anyway, so we ran out of names. My father died when I was 18 months old, and my brother, who was 15 at the time, died 11 months after my brother to the day. And he accidentally drowned. I started studying piano at age 7, and I played for my first worship service when I was 10 years old at Mount Vernon Methodist Church in Trinity, North Carolina. My childhood home was located in Glenoa, which is halfway between Archdale and Southdale. And when Mother died, I sold the farm, which was 18 acres, and it's now part of what is Holly Ridge Golf Course. So, at age 15, I was awarded a Sanford scholarship to the North Carolina School of Arts. Terry Sanford was our governor at the time, and I went to School of Arts and was there for 2 years, where I majored in organ and minored in piano and vocal performance. In 1968, I was drafted into the United States Army, had basic training at Fort Bragg, North Carolina, and everyone in my company, except 2 people, were sent immediately to Vietnam after basic training. One guy was sent to the Pentagon, and I was sent to Fort Hampton, New York, to the United States Army Chaplains School. And from there, I went to Fort Carson, Colorado. Was lucky enough to sing with Colorado Springs Opera Company for 3 seasons. And after that, I was sent to Seoul, Korea. I was diplomatic to the American ambassador to South Korea. That was William Porter. He is going to chair the peace talks in Paris, ending the Vietnam War. He had wanted me to move to Paris, but I would have had to sign up for 2 more years in the IS. You're going to spend that. After I left the service, I came back home and was able to use some money from the government to spend 2 years at Davidson Community College studying psychology and journalism. Got a degree there. And then I went to Switzerland with, so I went to RCC, got a design, a degree in interior design, and worked for Randall Tysinger selling antiques. And let's see. 2008, thanks to Phil Griffin, I was his first member when he was president. And that was far beyond the most busiest and most rewarding year of my life. It happened in 2008. I was the president of the Rotary Club, and I was also campaign chairman for the United Way, Davidson County that year. I received the Mayor's Award from the City of High Point for the 2nd time for being Vice Chair of High Point Historical Preservation Commission for 9 damn years. 10 years earlier, I had gotten the Mayor's Award for the City of High Point for contributions to the arts of the City of High Point. And that same year, the Chamber of Commerce named me Persistent of the Year. So a lot happened in 2008. I'm currently ordinance choir master at Heidelberg Church. I've been there 16 years. I play at Memorial Methodist Bible class for the radio broadcast, and have done that for the last 18 years. I play for all the weddings and funerals at Western Memorial Church in Heidelberg, which is the home church. And so by Sunday, having played at Memorial Methodist at Heidelberg, I got all the religion I need for the week. I was also with the North Carolina Adjunct Executive Committee for 35 years. I did judges seminars, and I told judges what to look for in piano and vocal performance. And one of the greatest blessings in my life, I've had lots of them, is being a part of this organization for 25 years. Since I was 27, I didn't have a mother or a father. I've been on my own, and you are my family. And I look forward to seeing you every week. I love you. Thank you.
Well, we love you too. So. Thank you for sharing. Okay, we'll jump right into our program for today. Bill, do you want to come and introduce your guest? They just have already got us on the slide. We're moving along.
Yes, on that side. I'm delighted today. You gave me the microphone. It can be risky sometimes. To introduce Lillian Koontz. She's been the health director for Davidson County for quite a long time. I'll let her go into how I think it's at least 10 years. For Corey, she went to UNCW environment. So she did environmental studies with a biology concentration and a minor in chemistry. Sounds like a lot of classes I didn't want to take. Now, for Don and some of the other ones, she found a different path for grad school and went to Appalachian State. So we can see it. She's reformed, and Corey kind of is. But anyway, I did look, I had Lillian on my board when I was with Smart Start, and we were in that historical time frame called the pandemic of 2020. I was following her almost, at least 2 or 3 times a week, trying to figure out how this might affect childcare. We had to be the guidance for all the childcare in the county, so I was following her quite a bit. Steady hand. I was glad. I always felt like she may not have known exactly what she needed to say every time, but she at least looked like she said it with authority. And during that time, I don't think anybody really knew what was going on, what may or may not happen. People were actually dying from it and all that. But so we have quite a bit of history. I don't want to go on because I know she can tell you all about this. But without further ado, Lillian, thank you.
I guess I'm just gonna hit this little thing here a little bit. Look at that.
Please,
All right, step one.
Consult Jason, not me.
All right. Well, y'all, thank y'all so much for having me. As Bill did such a great job introducing me, I hope that I live up to it. I serve you all. I am your local public health director, so thank you for being a citizen of Davidson County and allowing me to do this job that I love so much. I love telling people what we're going to talk about when we talk about it, so you kind of know where it's going to go. Bill gave me strict orders that by 1 o'clock y'all are moving and shaking, so I'm going to get this done. We are your local health department. Prior to 2020, there were many people in Davidson County that were very unaware of what the public health department was, where we were located, and what we did. On board a national, global pandemic, and all of a sudden your local public health department, who historically sort of prided itself on operating in the shadows, was now front and center. My face, my name was everywhere. My staff and co-workers' names and faces were everywhere, and we were not very comfortable with that. We are not elected officials. We are not politicians. We are not public speakers as a general rule, but we sure had to figure that out pretty quick.
Our mission is to assess and protect and promote the quality of life of Davidson County, and we do that in a variety of ways, which I'll go into. This is our office. For those of y'all who have been around for some time, you may remember there used to be a local health department location right here in Thomasville, North Carolina. That location closed after I started with the health department. I started there in 2007, and I joined the team in environmental health. At that time, the facility was open over there by the hospital, but what ended up happening was people were not coming to that location and using it. So ultimately, and unfortunately, due to budgetary constraints, they just closed it down and only operated in Lexington. I know that does not sit well with everyone. We know that everyone doesn't love it. But at the end of the day, it was a dollars and cents thing, was the way it was told to me. I had no part in that conversation, no part in that discussion, and as an employee, I had only been in there once in my career when they closed it. So, we are a core public health service agency. And what that means, the simplest way I can describe it is, we work on your tax dollars. We use Davidson County tax dollars to work, and we use state tax dollars and federal tax dollars to work. What that means is we do not want to compete with private organizations or other nonprofits that are going to do the work in Davidson County. We are a safety net provider. So I'm going to run through some of the services that we provide, but I really do like to tell everybody, we are a core public health agency. We do not do a wide variety of services that you might see in other communities. And that's because in Davidson County, we're fortunate. We have Atrium, Wake Forest Baptist Health, and Novant that operate here. And they have all sorts of doctors' offices in different locations. We also have the federally qualified health center, Integra, that provides medical services. So we don't have to be in the medical services game. Now, if something were to change, we are front and center responsible for that, but as it stands right now, we let our tax dollars work in different ways. One of the big things we do are immunizations. Again, everybody got to know us in COVID because we were providing those. When the COVID vaccines first arrived, the local health department was the only place to have them. That was not the kind of popularity we wanted. It was definitely, we were prepared and ready, but it was a hard job to have at that time. In the beginning, y'all may remember, everybody wanted a COVID vaccine. The people that got them took to social media and bragged that they had the COVID vaccine. And then about, I don't know, a month and a half later, people were like, oh no, wait, I didn't get it. And I was like, but we saw your shit. But things changed, you know. But in the very beginning, it was incredibly popular to have it, and that made us where everybody wanted to be. We also do other immunizations. Right now we are ramping up. We've got kids back in school, and if y'all don't know, the school systems will tell you you can't come back if you don't have your required vaccines, and so we're starting to see a lot of kids in the health department right now. We also do travel vaccines when folks go on really cool trips. Number one, I'm jealous. And number two, we'll help you if you need a vaccine. So some countries really, you need to get a vaccine before you go there to protect yourself. We have them for you, just call us and make an appointment. We have the WIC program. WIC is Women, Infants, and Children. If y'all shop at the grocery store, you may recognize this sign. They look somewhat different in different stores, but it is a supplemental nutrition program for children up to the age of 5 and pregnant women. We want to make sure that those babies are getting a good start and they're eating nutritious foods, so we have the WIC program. Y'all enjoyed a meal prepared for you today by an establishment that was inspected by your local health department. We do all of the restaurant inspections, and that's one of the things that pretty much everybody that I've ever talked to has experienced from the public health department, because I've not yet met a human who has not been able to eat. So that is one way that the public health department serves everyone. We also do septic systems. If you do not live in the city limits or are connected to a sewer system, you have a septic system in your yard, that's us. If it fails, call us, we'll help you out. Vital records, births and deaths. This is one of those things, when you become a local health director, you of course prepare for the interview, you think you know what you're signing up for, and then all of a sudden something comes across your desk and you're like, oh, that's my job? This is my job. Apparently my name is on birth and death certificates in the county. Shocker. Because people call me and want to know why I said somebody died, someone was like, I did not, but your name is on it, it was not me. And another thing that's interesting, if you would like to ship a body to a different country, I have to sign off on it. So that was like all kinds of shocking things. So that's some of the work that your public health department is doing for you. And the reason we sign off on it is to assure that there wasn't a dangerous disease or outbreak when it happened. But the first time I got that call, I was like, y'all want me to do what? And I think it was going to El Salvador. I was like, I was like, is it even in English? Like, what are we doing? So, one of those things, kind of build the plane as you're flying. We do school nursing. Those folks enjoyed their summer off, but now they're back at the health department. In Thomasville City Schools, we have 3 nurses. In Davidson County, we have 39 schools and like 11 nurses. They're all spread out. And then in Lexington, we also have 3 nurses. We do family planning services. If you want a baby, great. If you don't, great. We'll help you out with that too. We also do care management. Women who are pregnant or young children who have high-risk needs, we will help you make sure that you're getting all the help and care that you need. Communicable diseases. This is one of the less fun things that we do, but one of the more important things we do. We do foodborne illness, tuberculosis. If y'all are like me, you hear about TB and you think of like Val Kilmer, Doc Holliday, that old stuff, like people don't get tuberculosis anymore. Aha, you have an active case in Davidson County right now. So tuberculosis is still around, it's going on. Active cases are incredibly heavy lifting because you have to stay away from folks for a long time when you have tuberculosis because y'all know, you saw it in the movies, it's a horrible disease and we have to keep those folks isolated. So we have to check in with them daily, monitor their symptoms, and make sure that they're not spreading it to anyone else. I also had a report this morning. We've had an incredible jump in our foodborne illnesses, and we're not even tied to any one thing. So if you go out to eat or you prepare a meal at home or anything like that, and you start getting a tummy ache and you end up going to the hospital and they test what you've got, if it's a foodborne illness, you're going to get a call from us at the health department. Didn't know if you know that. A lot of people are like, how did you get my number? What do you want? But it's our job to try to figure out the source to make sure that these types of things don't happen. So if you get salmonella, Campylobacter, we're going to give you a call. E. coli, we're going to give you a call about that too. So we've seen a great deal of different cases. And so our CV nurses working with so much is like, we can't pin it down to anything, but we've got a lot of activity. So if you do experience an illness like that, we always encourage getting medical treatment so that you can get nipped in the bud. In Davidson County, y'all may know this, but we serve about 177,000 people. And our budget is about $9.5 million. We have about 90 employees that work for you at the health department. We range from Danny Starks, there's Danny, Spencer, our nurse practitioner, who we just love at the health department. We only have one of those right now. We have nurses, we have environmental health specialists, we have office support folks, we have a business office, all kinds of things. We also do health promotion, where we do education in the community. We go to different groups and talk about all sorts of things, health, diabetes, all sorts of stuff like that. We have a preparedness program. They were quite busy during COVID. They were the folks that sort of set up all the clinics that y'all saw, and they just keep us prepared for anything that may be coming down the pipe. We also have interpreters. We have a lot of folks in Davidson County that choose to use an interpreter when they come for services. We only have Spanish interpreters. However, if people speak another language, we have a phone call that we can give them a buzz on that line and we can help translate those services. Our local public health department is governed by a board of health. We have a previous board member in here. We have a previous board member's daughter in here, so I just love being around my family, the board of health. But the board of health is dictated by North Carolina general statute. We have all these positions that are on there, and what's interesting is if the pharmacist rolls off, we get another pharmacist, and it's to provide a wide breadth of experience and folks that know about public health to provide guidance to me and our team to make sure that we're doing the proper things in Davidson County. Our local board of health does have some rules, and just because we're Davidson County, we also apply those rules in the city limits. So, mobile home parks, we do checks on those. We have recreational water facilities, which I would like to say is the only set of rules like this in the state of North Carolina. And we had to create them. If y'all are aware of Elevated Wake Park, that's over there by hospice, let's get to see some headlines. When that place was built, we were like, what a cool idea, this is gonna be great. But they're gonna charge money, there's gonna be a gate, and people are gonna be in water. We inspect all the public swimming pools because water is a vector to transmit disease between people. And so we thought, well, okay, is this place going to be a swimming pool? It was not. It has a porous surface, so we contacted our friends at the state. They're like the experts, and they're like, we don't know anything about this. What are you going to do? And our Board of Health, again, those professionals that we have, were like, we think this could be a public health concern. So we gathered our stakeholders, and we were like, we need to develop rules. So we did that. So Elevated Wake Park and the quarry where you can scuba dive are our local recreational water facilities, and we check their water out a few times a year to make sure that there's nothing horrible in there that'll make you sick. And then we also have some signs posted that's like, don't drink this water, and this isn't pool water, so folks know that there is a level of risk by participating in sports there. And then we also do the rules for the local control of rabies. North Carolina law requires all dogs, cats, and ferrets, or maybe better described as puppies, kittens, and ferrets, to have a vaccine against the rabies virus by the age of 4 months. Super important that you do that. Last week, we had a rabid fox in the northern part of the county. A lady was outside with her dog. She and her dog were both attacked by the fox. They're okay. But the dog was up to date on its rabies vaccine, thankfully, so it just got a booster shot. If the dog was out to date or had never been vaccinated against rabies, we would have to euthanize that dog. I hate making that phone call when you have to call somebody and tell them, I'm very sorry, I know you had a traumatic incident, but guess what? It's about to get worse because you're going to have to euthanize your dog. Or you can pay for it to be held at a veterinarian's office for 4 months, and those holds are very expensive because they have to be held by themselves and far away from folks, and it's usually cost prohibitive. So please, when you go home, if you're a cool person and you have a pet, I'm not saying you're not cool if you don't have a pet, but you know, I love my pet. We were already talking about dogs an hour earlier, so pets are great. Check your rabies vaccines because rabies is running around. We've had foxes that have been rabid. I got a call yesterday from Denton about a funny acting skunk, but they shot it in the head, so we couldn't test it. So that shot, right? Didn't tell us but anyway. But it is running around, and you definitely want to make sure that that situation is not worse if your pet is not vaccinated. So please do check those dates. Public health in the news. Y'all may have seen, it's coming at us like, sometimes it feels like we're drinking out of a fire hose with federal changes. The changes that we've seen most recently are cuts to the Medicaid program. Like I told y'all, the Davidson County Public Health Department is a core public health services, so these Medicaid cuts are not going to shut off our lights, we're not going to stop providing services. We do so few billable services in our clinic. We're in good shape right now. But this is going to affect other places, and we're just kind of keeping an eye. If you're a hospital and you're relying on those dollars and you're taking a 10% cut, that's pretty significant. A lot of the people in North Carolina are on Medicaid, and when that's your billable insurance and you're seeing a 10% cut, it can create some significant issues. Communicable diseases are always something that we're working on. We try to stop them before they start. If somebody's sick, we want to get them the help that they need so they don't get somebody else sick. And COVID is back on the rise, y'all. I don't know if y'all know it, but like right now we're seeing a lot more cases. I don't know if that's because Lexington City School started a couple weeks ago. We sort of anticipated after Thomasville and Davidson go back to school, we anticipate about 10 days we'll start getting some more calls about this. People have been apart now, some are back together in close quarters, and bam, we share things. Also not on here, but y'all may have seen recently, the measles, there was an outbreak in Forsyth County. We had just participated in a tabletop exercise, which is for those of y'all that don't know, just like a practice with partners with Forsyth County and other counties in our area, and we practice what we would do if the measles showed up. And y'all, if you build it, they will come. We had the exercise, and 8 days later, we had a measles outbreak in Forsyth County. We were like, somebody was not knocking on wood. What happened? But that's okay. We were prepared, and that case did not spread, and it was the one isolated incident, and that's exactly what we want to see. We know that things like communicable diseases happen, but we want to be prepared for them when they do. I think I talked fast enough, and it's 1 o'clock. But if y'all do have any questions and you do want to sit a little bit longer, I'm happy to answer them. If you don't, y'all been great. It's so wonderful to see you. Yes, sir.
I was out of town, we were out of town last week, where we had ordered my dog. Before they would take my dog, they had to be vaccinated with a dog flu vaccine.
Really? Okay, so that means they've seen it later.
I'm not getting off on that such a thing.
No, it's more like a portatello maybe, but I'm not an American,
It is such a thing.
but yeah. I know when I take apple in my dog, they're like, just out of the next portatello, you gotta get it, so. Here we go. There we go. Yes, ma'am.
Lillian, is that breakdown for your Board of Health, that's dictated by state statute?
North Carolina General Statute. North Carolina General Statute also in the past 15 years created a provision if your county commissioners would like to take over because they've got it figured out, they can. And that has happened in some counties. It almost happened in this one. Several of you in this room were instrumental in that not happening. So I would just like to say I truly believe in the power of professionals, and our Board of Health are professionals who volunteer. Now, they do get paid a whopping $20 a week. So, you know, they're really getting rich on that. But I say that it's a joke, but the truth is those folks are dedicated professionals who work in this community, who have an invested interest in this community, and don't have any political agenda. And they are wonderful people on our Board of Health. So I was incredibly thankful to see that we retained the control of the governance with the Board of Health today in City County. All right, thank you so much.
Thank you for sharing, Lillian. I learned a thing or two there. And this is what's great about Rotary. I feel like we always learn something. And I guess we also just learned that it is a thing that dogs can have the flu. The resident veterinarian has told us that. All right, well, let's stand together as we close out today. We do this challenge every week, but as we head out into the separate quarters of our community, as we leave this place, it can be empowered by Rotary's mission to serve and service above self. Let's leave this place with eyes that are open to the needs of the community, ears that are open to the needs as well, and a heart that's ready to serve. You know, all the things that we think, say, or do first.
Is the truth, is fair to all concerned, will it do with the will of their friendships, will it be beneficial to all concerned.